So, hello.
Hi.
Thank you for talking to us. It's a pleasure to have you with us. For the sake of our audience being more informed, please introduce yourself and tell us a bit more about your major expertise.
My name is Anželик Джени. I'm the Director of Family Violence Services at Child Development Institute, which is a large child and family service organization in Toronto, Canada. My area of expertise is violence in families, and my doctoral research was on looking at risk and safety within child protection work with domestic violence cases.
Can you tell us a bit more about your visit to Bulgaria? What's your mission here?
I've been asked as a consultant to come to Bulgaria and talk to all the stakeholders involved in your current system of responding to cases of violence against children. And so I spent a week here in July visiting areas within the country and UNICEF projects in particular, as well as ministry representation and all of the stakeholders involved in your system that responds to violence against children. What I would consider a child protection system, even though I'm going to try not to use that language because in Bulgaria you have child protection departments and it's not exactly the same as I keep referring it to that way.
Can you explain to me and to the larger audience what should we understand about violence against children, what it is all about?
I think what's important to consider about violence against children is that it occurs in many forms. And I think that for most people, we're thinking about extreme forms of violence that people would say was definitely not okay. Severe physical abuse towards children, sexual abuse of children. I think that's something that you find in general the public would say was not okay behavior. But there are other forms of violence against children that are more insidious that happen in communities. Neglect, children who aren't getting enough to eat, they're not getting enough attention, they're not getting enough schooling or support with school, they're not getting enough emotional care and protection from their environment. So those are other areas that we see, emotional maltreatment. Another big area that is harder for people to recognize is that children living in homes where there's conflict between adults, so violence between their parents in particular, is very distressing for children and can cause quite a bit of harm for them to be exposed to. So I think there's such a range of issues for children, and when we think about violence, there's lots of levels of violence that we're not always recognizing. We've even been talking about the amount of violence that children experience within school systems, sometimes from teachers themselves, but often from other children, peer-to-peer bullying and other forms of harm.
At the beginning of this week, very alarming data was released by the UNICEF office in the UK. It states that every 5 minutes a child around the world is killed due to violence. Can you tell us, I'm sure that you travel a lot and you have a lot of insight, how serious is the issue of violence against children globally?
Oh, the issue of violence against children is certainly a serious problem. You've just given perfect statistical evidence of that yourself. I think, again, the levels of violence, depending on the country, would range in terms of severity. We're certainly seeing in other countries violence that's particularly directed towards girls, young girls, lots of concerns about early marriage for young girls, and of course any kind of trafficking of children. That's another serious global issue where young children are being trafficked for physical labor, but also for sexual labor, which is particularly concerning.
What about the situation in Bulgaria? How do you see the problems here? What worries you the most when we talk about violence against children?
I think Bulgaria is probably facing a lot of the same issues that you see in other countries. They are certainly on the right track in terms of many of the policies and legislations that are currently in place here in Bulgaria are definitely very proactive and child protective. I think that we were talking today in a workshop earlier about how the Child Protection Act has only been in place and active since about 2000, 2001. And if you think about the amount of effort that's occurred in the last 14 years even, that's some very promising work and promising practices. That said, the more you become aware of a situation, the more resources you end up having to put into it. So we know that violence against children happens on one end of the continuum in terms of abuse and neglect, but we also need to think that we can prevent violence against children by providing public education and family support around making sure that families have enough resources available to them, there's enough money for food, there's enough support around single families and children being able to get all their needs met. So sometimes you have the protective piece around preventing violence, but there's also another model where you can provide support for families to prevent violence from happening in the first place.
Can you give us an example or a few examples, if you'd like, about violence against children in Bulgaria, something that you have been observing recently or generally? It could be a trend, it could be a specific case that worries you.
It's a hard question to answer in terms of trends. I'm not sure. Certainly I've heard a number of stories in the last little while in terms of my work here. Concerns about violence that's happening against children in institutions is particularly concerning because, you want a system where children who are in institutions should be your safest children because they're being raised or protected or surrounded by professionals. Violence that happens between children in institutions might be expected, but certainly violence that's happening from staff to children in institutions should not be happening and is completely unacceptable and inappropriate. And you'd want to make sure that that kind of thing is not happening. Also, understanding that children who experience violence can end up on a very difficult and negative trajectory and may end up in trouble with the law. And so having some idea about why we see children committing crimes, committing offenses, and starting to do some of that work to look back earlier to say what's going wrong for these kids earlier in life. Why are they ending up on this trajectory? Is it because we haven't intervened early enough in other areas? So I think there's some concerns there that are beginning to be addressed here in Bulgaria. There's also concerns about this early marriage of young girls in particular communities that needs to be addressed, although I think people are talking about it and they know it's a problem. So that's always a start and a beginning. The other trend I think I've heard from people is this belief that there's a public sense or a general sense that children are still property of their parents, that children don't have the same kinds of rights that adults do, and that there's still a belief that hitting children is a form of loving them enough to, morally correct them through violence. But there's lots of ways to keep children on the right track that don't involve creating fear in them, making them feel bad about themselves, or physically harming them in any way. And I think learning new, more positive parenting strategies that don't rely on corporal punishment and other methods of physical discipline will take us a long way in terms of protecting children for the future.
According to your observations here in Bulgaria and as a whole, who are the children who are most likely to become victims of violence? Are there a group or groups of children who are more vulnerable?
I think certainly children who are most vulnerable are children who aren't visible within their communities. If you want to help children, you want to increase their visibility. You want them going to school, you want them in early child care environments, you want everyone to be able to see a child. The less likely, the less often that a community sees a child, the less able they are to identify when something's going wrong. So children who are living in impoverished neighborhoods or where they're marginalized, who might not be accessing all of the other services like early childhood education. I think some of the very promising practices are, I know there's only a few projects, but maternal home visiting, where the youngest children are your most vulnerable because they're not seen and they don't have the verbal skills to tell us when things are going wrong. So you want kids to be visible, and you want kids to know what's okay and what's not okay, and that they can tell adults when things are going wrong and they can expect to get help from it. I've heard from many people that I've talked to that part of the problem is that children are so used to some of the abusive parenting practices that they see in the community that they would never tell anyone that they were being harmed because they would think it was so normal. So those are also, I think, areas of risk when you think of, if you want to protect children, you need a community. When I think of an ideal child protection system, I think of the ability to recognize and identify abuse that's happening, that you have someone to report it to, that you have someone who will respond and try to stop the abuse, that you have someone who will then try to protect that child either through prosecution or intervention services so that they've been protected, and that you ultimately want a system that is working to prevent abuse of children, to prevent all the conditions that make violence against children possible.
Can you elaborate a little bit upon that? Because it's interesting for me and for our audience, what could be done in Bulgaria or in general so that we could have a system that prevents abuse and violence rather than acting upon the consequences?
I mean, that's what every society is trying to be in the forefront. Everyone wants to prevent abuse, and often it takes seeing it to understand the mechanisms for preventing it. I think what we know from other communities that are getting really good at this is, again, the visibility piece, making sure that children aren't isolated within families where they're basically not being seen by other community members. And you want your public to be educated and to feel responsible for every child that they come in contact with. To not have that sense of, it's not my business or it's not my responsibility. The belief that every child's safety is every person's responsibility. That I might not know that child, but I've seen something and I'm an adult and I have a responsibility to tell someone else about it to keep that child safe. That's really what you want if you want to prevent abuse of children, because it's very hard to abuse children if other people are watching you and letting you know that it's not okay. And sometimes people don't abuse children on purpose. And there's a large percentage of abuse reports that are really about discipline that's taken too far, that parents are trying very hard to get their child to do what they want them to do, and they just don't have the skill set to do it in a non-violent way, or they just go overboard when they're trying to use discipline. So education around physical discipline isn't good for children. It's not helpful. You may control a child's behavior, but you're controlling your child's behavior through fear. It's not really moral development. You haven't really taught them how to solve problems or to think differently. You've taught them to be afraid of you and to avoid you, or to not get caught, as opposed to, I'm not going to do that because it's not the right thing to do. I'm not going to do that because I will get hit. It's not exactly how you want to change your public's perceptions of what good moral behavior is. So I think that that's part of prevention, is letting people know all the different ways that children should be treated or thought about. And it's also, I think, increasing the understanding of children as having rights and children as being harmed by being called names, by being not cared for properly, that these are early experiences that will come later, and that children learn very early about how to be in a relationship. And if your first relationships involve physical violence or emotional violence, that's your model for how you're going to be in a relationship later. And that's, again, it's not the ideal way that you want your community to evolve.
Apart from awareness raising and advocacy and education, as you mentioned, what's your feeling about, let's say, governmental funds, the majority of which are currently directed towards coping with the consequences or investigating cases of violence, neglect, or abuse? Should they be refocused, redirected to prevention as well?
Well, that's a very difficult question to answer, because you clearly have to have a balance before you don't want to take money out of one area to put it in another at the expense of the other. What you really need is an equal set of resources that go into your prevention as well as your response mechanisms in the beginning. And that what you would hope is that over time you wouldn't get the kinds of reports, so that you could scale back on the kind of protective mechanisms you put in place, because your preventive mechanisms are already showing progress. But to do one before the other, I think, would leave both at risk.
This is a wide question, and I know it has a million possible reasons, but what do your observations tell you? What are the most common reasons for adults to resort to violence against children? Why do they use violence against children?
Again, that's a difficult question, because so much of violence that's perpetrated, there are individual reasons. I think you'll hear a lot of individuals would tell you that they didn't know any other way, that that's the way they were raised. They remember being raised this way, and that's fine. They were fine, so I should be hit my child. My father hit me, and everything was fine. That I think there's some general beliefs that people will exercise the same kind of parenting that they experienced themselves. There are also issues of poverty and lack of resources. Sometimes children are abused because their parents don't actually have the resources. They don't have enough money to send them to school, or they don't have enough money to keep them living in the same place over time. Families that are transient or homeless, those children are being exposed to all kinds of harms, and it might not be because their parents are deliberately trying to expose them to those harms. It may have a lot to do with what is available to them resource-wise. And then I think there are another set of adults who are perhaps more, when I think of child trafficking and some of the more organized forms of sexual abuse of children, that these are parts of values that children, young girls aren't, they don't have the same kind of worth, and that you can buy and sell them and make profit off them, and somehow that's okay, that they're somewhere along the line they've missed out on that moral obligation to keep everybody safe. But where that stems from originally, from each person, whether it be some sort of mental health issue or their own upbringing or pure financial greed, that where they've had nothing their whole life and they've just realized that they can make so much money off of a young child and it costs them nothing. I'm not sure what the answer is to all of that, but it's no less disturbing.
Can you share with us what are the most common symptoms of a child being abused or being victim of violence?
I think the clearest thing for people to look for is any change in behavior. I mean, obviously, if a child's been abused all their life, maybe this behavior will always look that way. But often when you think of looking for symptoms that a child suddenly they're different. So whether a child's suddenly withdrawn and they weren't before, or they're suddenly acting out and they didn't do that before, they're suddenly not eating or sleeping, or they're complaining about other difficulties, and then you might want to ask them questions about where that change of behavior has come from, and maybe that's when you find out that something new has happened that is harming them. Children who've grown up and have experienced abuse from the very beginning, you might see those kids as definitely experiencing difficulties with relationship. They might not be easy kids to be with or spend time with, or you might find that they have inappropriate boundaries and they want to, they'll be very close to adults they don't know. There's all kinds of different symptoms that you would look for. I think it's thinking about what we understand to be normal, healthy child behavior and development, and whenever we see something that seems to go not quite the way we think it should be wondering where that behavior is coming from. It doesn't necessarily have to be related to abuse, but it would be certainly one of the avenues for exploration.
When we notice some of those symptoms, how should we react? Any adult that notices a symptom that a child has been abused?
So I think it depends on that adult and their relationship to that child. If you're an adult that has a close relationship with a child that you notice a difference in, I think it's okay to say to them, you seem to be not yourself these days. Is everything okay? Is there something you'd like to tell me? If you don't know that child, or you don't have that kind of relationship, then maybe that's when you talk to a professional and say, I've got concerns about my next door neighbor's kid. I don't have the relationship to go and talk to them, but maybe someone should go and see them.
Do children lie about violence and abuse?
It's interesting. They're doing some very new research on children and lying. And what they find is that as children get older and understand moral development better, the lying decreases. But normally, kids lie to prevent being punished. They lie to not hurt someone's feelings, right? Because they learn, this is what they learn early to figure out, if I say that, that's going to hurt someone's feelings. Or if I say I ate that cookie, I'm going to get in trouble for eating the cookie. But when it comes to talking about whether something bad has happened to them, they're more likely to lie to protect their family because they've been told, if you tell that this is happening, something bad will happen to you. Kids are more likely to lie that abuse isn't happening to them because they're so afraid of what will happen if they get found out. They're less likely to lie about someone actually coming and touching them. The clearest or the most practical way to consider this is that children don't have the language of sexual abuse and sexual encounters at particular ages, the ones that we're so worried about these children lying to us. Where would they ever get the information to dream up this imaginary offense that happened to them? It's not within children's repertoires. So when children start talking about sexual things that have happened to them or bad things that have happened to them, my first thought would never to consider that they were lying about it, because it doesn't make developmental sense that they would even have the language or the ability to imagine that happening. There have been some concerns that adults can put ideas into children's heads so that children will tell a story that isn't true, and that can be possible at times. But again, a child that is repeating a story that's been told to them isn't capable of providing all the other context to that story that would make it real, because it becomes a story as opposed to an experience. And a good interviewer should be able to talk to the child and figure that out fairly quickly. So I think that concerns that children are going to make these stories up and lie and all of these people are going to be charged inappropriately, I think we've found out through certainly this was the early fear in the 80s in the United States when child sexual abuse was just becoming out. People were really worried that innocent people were going to go to jail. And the only time that happened is when adults interviewed children improperly and asked them leading questions and tricked them into giving answers that weren't entirely truthful.
At the end of the day, what could be done so that we could help children cope with the traumas of violence?
So the important thing is to get intervention for kids who've experienced trauma. Not every child that experiences a traumatic event will have symptomology forever. It depends. The key factor actually is in how they're responded to when they tell someone about the abuse. Disclosure is really important, and if an adult listens to them and says, "I'm glad you told me, it's not your fault, and I'm going to get help for you," that could mean a very big difference for a child in terms of whether or not they're going to require long-term intervention. But counseling, helping children develop a story or a narrative for what happened to them and how they can move on from that experience. Not necessarily, as I was saying to someone today, we can't take away the bad things that have happened to children, but we can help them understand what has happened to them, integrate it into themselves so that they can go on and lead productive lives. It doesn't have to become who they are. They don't have to be a victim for the rest of their lives, but they have to understand, this happened to me, this is what I feel about it, this might be what I can expect to happen in the future, and this is how I can cope, and this is how I can move on.
My final question, in the course of this interview now, talking about this sensitive issue of violence against children, is there something that I didn't ask you but you feel strongly about, a message that you would like us always to keep in mind when we talk about violence against children? What should we always bear in mind when we address this really sensitive issue?
Well, I think we have to remember that children are people. They're not adults, but they're people and they have feelings. We were all children once, and we know that we had feelings. We know that we know that infants have feelings. We know that infants are initiating human contact with the way that they look in their mother's eyes and the little smiles and the gurgles they make. Right from the beginning, we are hardwired, our brains are hardwired to relate to other people and to have positive, healthy relationships with them. We should always think that children are just trying to find a connection. It might sound silly to say everyone just wants to be loved, but all children are trying to feel love and approval and safety in their lives, and it's up to us to provide it. Whether we're the person next door, whether we're the teacher in their classroom, it's up to all of us to make children feel valued and safe in every environment that they're in.
Okay, thank you so much.